New videos every day.
Hi, I'm Dr. Vince Belanzi. I want to talk with you tonight about food allergies. Now, if you talk to a conventional allergist, they're going to tell you that there is no allergy unless there's a skin response. In fact, they're going to tell you that you can't effectively test food allergies. If you talk to other people, they're going to tell you that the skin test isn't even real valid and that there's other ways to test. The truth is that both are right. On the one hand, we can't effectively test food allergies through the skin. The skin tests an antibody called IgE. We're looking at what's called a type 1 response, and that's better used for testing for grasses, trees, mold, things that you get a runny nose from the environment. If we're going to look at food, we usually have to look in the blood. So we pick the major antibody in the blood, which is IgG. Now, this is called a type 2 response. The reason I'm telling you this is because you can be allergic in one or both. You can have a response to food, right? You probably know people who eat a peanut and their throat closes up. Well, that's a type 1 response, and that was mediated primarily by that IgE that I mentioned earlier. And you'd probably see a skin response to that. But there's not a lot you can do with that. Now, we do the testing, and sometimes you can use an allergen and produce an immunity, and sometimes you'll alleviate symptoms. But really, that's about a 50-50 chance. What we've had much more success with is testing food allergies through the blood. We test that major antibody that I called IgG. We find a response. The labs we use will test each food on the list against that IgG antibody, and we'll have a list of foods that you're intolerant to. Now, that's an important concept, food intolerance. You could be eating things, in fact, you probably are, that prime your immune system. Now, we use the word priming when we talk about immunity and viruses. And what you're trying to do with an immunization or a vaccination is to prime the immune system to be ready against a threat of the same virus coming into your body again. Well, if we look at priming by foods, you may be eating a food that's priming your immune system and keeping you overreacted to everything in the environment. That's what we find happens. You eat the food, you prime the immune system, and your body's much more on guard for anything that may show up. So let's say we're here in Austin and we worry about cedar fever. It's not really a disease, but a lot of people react to cedar. It's an overreaction. Ideally, or normally I should say, you breathe in the cedar pollen, your body has a reaction, but you don't know about it. That's normal. The problem is with a lot of people, they breathe in that cedar pollen. They've already primed the immune system. It's hyperreactive. It overreacts. Some people have to go lay down. They can't function. They get a headache. Their nose is running. All this because of a little cedar pollen. That's just outrageous. Why should a cedar pollen be able to take you down? It shouldn't. That's not normal. So what we find is if we test these foods and have you eliminate them for a short time, usually about 2 to 3 months, but I actually like people off the foods for about 4 months, we see the whole immune system become functional again. Everything calms down. The overreaction stops. I'll give you an example. Had a patient the other day, rock climber in really good shape, but he had to carry all this medication with him. He had to carry inhalers and other things to stop his asthma. Every time he would breathe cedar, and in here where we live, cedar's active a couple times a year, he might end up in the hospital with asthma. Here's somebody in good shape, but overreacting. We did the food allergy test. We had him eliminate those foods. Guess what? He doesn't get asthma anymore. His body doesn't overreact. That's the approach that I want you to take. That's what we talk about when we're testing food allergy. We talk about testing something that we have control over. You can control what you eat. So if we identify foods that are causing you a problem, and we have you not eat those foods, your body not only will stop reacting in the immediate sense, but you can stop reactions forever. You can help all parts of your immune system calm down. Now remember, you've got many different antibodies. So we can't just talk about IgE or IgG. There's IgM, there's IgA, and there's subclasses of all these antibodies. So there's a lot going on in your immune system. If I, in a sense, turn up the volume, you become reactive to everything. Pretty soon yourself. That's the big threat, what we call autoimmune diseases. Now, when we talk about autoimmunity, we talk about rheumatoid arthritis, we talk about systemic lupus. There's a number of diseases where your own immune system has begun to attack you. That's a created problem. It's not genetic. It's not because you're unlucky. It's not because God doesn't like you. It's because you've allowed your immune system to overreact. So many people come into our clinic with these problems. They've been labeled with some disease or another, and it's really just a matter of their immune system being out of balance. And the best way that I found to balance the immune system again is through diet. So one of the tools that we have is what I'm talking about, this food allergy test. It's been a great tool for us. We've done thousands of the tests, and it's always shown its benefit. Sometimes small, sometimes really big. I'll give you another example. We had a woman come in. She had what we call erythema, but a redness from her chin all the way down to her chest. She got it once a year. Nobody could figure out why. Once a year, she would turn beet red from under her chin down to her chest. Guess what we found? She was allergic to pumpkins. Now, nobody had tested that. We identified it on the test. We had her stop eating pumpkins. She actually didn't believe us, so the next Thanksgiving, of course, when this would always happen, she tried some pumpkin, and there was the rash. Anytime she gets near pumpkin, it causes the problem. Well, it's an overreaction, but we were able to identify the food and get her away from it. The last I heard, she was less reactive, and it had helped her overall in health. So food allergy can be a real good tool if you know how to use it. Again, it's not a matter of getting a skin test or a scratch test. We use that. It can be a tool, but it's all in trying to get the immune system into balance. One more point that I want to tell you. You have to be real careful with things that you do to your digestive system. We do a lot of weight loss, and people often, instead of doing what we do, they use bariatric surgery. Well, one thing I want to tell you about allergies, your immune system is actually programmed by your digestive system. So if you're ever considering bariatric surgery, don't, because the recent research shows that it can affect your whole immune system. Since your digestive system can program your immune system, that's the place to work, but it's also the place not to mess around with. In fact, the food allergy test also comes into play here because we have to worry about what's called your normal flora. The probiotics, the good bacteria, and the good organisms. There's about 500 of them that live in your gut. If you upset that balance, of course, we know antibiotics and steroids and many other medications can do that, but also this food allergy. If you're having these allergic responses and your digestive system can't take care of itself as far as the immune system goes, you're reprogramming your whole immune system. So that's where these problems come about. Interestingly, they're finding that infants that don't get their first dose of probiotics from their mother have autoimmune diseases later on. They're tracking this. There's some very interesting research going on in England especially. And they're finding that infants that don't get the probiotics don't get their immune system programmed correctly and have problems lifelong. So there's a lot to do with what goes through you in your immune system and its relationship to your digestive system. You want to be real careful on the choices you make because your biggest exposure to the outside may be your skin, but you also have a great exposure through what you put in your mouth. So be careful. Read your labels. Watch out what you put in. And if you're having a lot of symptoms, maybe you should consider a food allergy test. This is Dr. Vince Melanzi. If you have any questions, please visit us at my website, which is www.bewellrx.com. That's BEWELLRX.com. And you can find information there on the test, or you can email us and ask us questions. Good evening.